Alright, my name is Hannah Foster and I'm going to be doing the IV insertion video. So I have verified my physician's order to start an IV. So I'm going to come into my patient's room and I'm going to use two identifiers asking for their name, first and last, and their date of birth, as well as checking their wristband. Then I am going to wash my hands and apply my gloves. At this point, I can ask them if they have any allergies, and they said no. And then I'm going to ask if they have any questions and check and see if this arm is okay to use. They said that it's fine, they don't have any contraindications. So I'm going to apply my tourniquet 4 to 6 inches above my insertion site. Once I do that, I'm going to check the radial pulse. I'm going to identify which vein I'd like to use, which I'm going to use this medial vein right here. In the meantime, I'm going to release the tourniquet so I can get my supplies ready. And while I'm at it, I'm going to write on here what date it is, the time, and my initials. Okay, so I'm going to go ahead and cleanse the vein. I'm going to cleanse for 30 seconds using an up and down motion. I'm going to let that air dry for 30 seconds. While I let this air dry, I'm going to take my equipment and get it ready. I'm going to just loosen this, but I'm not going to remove it. Then I'm going to take my normal saline, making sure to get this air bubble out and do that. Alright, then I'm going to prime my tubing. Once I see that, I'm going just to put that back like that. Alright. So we've got that ready. So I'm going to reapply my tourniquet. Checking that pulse. Alright, we're good. Take my needle. We've got a 22 gauge. I'm just going to check to make sure it's moving. We're going to go bevel up. I'm going to stabilize my vein here, and I'm going to let the patient know that they're going to feel poke. We're going to go in at about a 10 to 30 degree angle. Poke. And once we see blood in the chamber, we're just going to advance it a few more milliliters, and then we're going to take our catheter here and pull it through. I'm going to hold this, applying pressure and removing the tourniquet, and then I'm going to take my IV out and apply the safety. After that, I'm going to take my tubing here and attach it. Once I do that, I'm going to flush with 2 to 3 mils, making sure that there's no pain or swelling while I do that. I'm then going to apply my dressing. I'm getting stuff all over everything. There we go. Once we get that, I'm going to just check it one more time, make sure we're good. I'm going to disconnect this, do my lock here, then I'm going to take some tape. And secure my tubing, and then I'm just going to add my thing with my date, time, and initials. Once I've done that, I am going to document everything and remove my gloves. Thank you.